It was just an ordinary Tuesday morning. Betty, a 69-year-old former office manager from North Carolina, was making her morning coffee when something felt different. She reached for her favorite mug, the one her grandchildren gave her for Mother's Day, but her hand would not cooperate. The mug slipped from her fingers and shattered on the kitchen floor. Her son David, who was visiting for the week, heard the crash and rushed in. "Mom, what happened?" Betty tried to answer, but the words came out jumbled like alphabet soup spilling from her mouth. She tried to smile to reassure him, but only the right side of her face moved. David did not hesitate. He grabbed his phone and called 911 immediately. That split-second decision saved his mother's independence, and quite possibly her life. Strokes do not announce themselves with sirens or warning bells. They slip in quietly, during morning coffee, Sunday dinner, or while watching the evening news. Sometimes the signs are so subtle that we brush them off as fatigue or just getting older. But here is what every senior needs to understand. When stroke strikes, every single minute counts. If you are over 60, or if someone you love is, you need to know these 6 critical warning signs, and exactly what to do when you see them. Welcome to Senior Health Facts, your trusted partner for staying healthy and independent after 60. Today's information could be the difference between a full recovery and months of rehabilitation, or worse. Let me share some numbers that might surprise you. Stroke is the 5th leading cause of death in America. But more importantly for our community, it is the #1 cause of long-term disability. According to the Centers for Disease Control and Prevention, nearly 800,000 Americans suffer strokes every year. 3 out of 4 of those people are over 65. That is our friends, our neighbors, our family members. But here is what makes stroke particularly dangerous as we age. First, it happens without warning. Unlike a heart attack, which often comes with chest pain, a stroke can strike silently while you are doing the most ordinary things. Second, our brain cells begin dying within just minutes when blood flow is blocked. Think of it like a garden during a drought. Without water, plants begin to wilt quickly, and the longer they go without, the harder it becomes to save them. Third, and this is crucial, delaying treatment by just 15 to 30 minutes can mean the difference between walking out of the hospital under your own power or needing assistance for the rest of your life. The Mayo Clinic research confirms this. The faster medical intervention begins, the better the outcome. Yet many of us hesitate when symptoms appear. We tell ourselves it is just tiredness or stress or part of getting older. But when stroke strikes, waiting can rob us of everything we have worked to maintain. Our independence, our ability to drive our clear speech, our capacity to care for ourselves. However, there is hope in this story. When caught early, many strokes can be treated effectively, and full recovery is not only possible, it is likely. Betty, whose story we started with, walked out of the hospital 3 days later and is back to her morning coffee routine, though now she keeps her mugs on the lower shelf just to be safe. Many seniors and their families make the same critical mistakes when stroke symptoms appear. These well-meaning responses can cost precious time and precious brain cells. Mistake number 1, the wait-and-see approach. Sarah, a retired teacher from Maine, felt her left arm go numb while reading her morning paper. "It will pass," she told herself, remembering how her shoulder sometimes acted up. She waited 2 hours before mentioning it to her husband. Those 2 hours made her recovery 3 times longer than it needed to be. Slurred speech, numbness, or confusion might seem to fade, but brain damage could be progressing silently. Never wait to see if stroke symptoms improve on their own. Mistake number 2. Driving yourself to the hospital. It seems logical. Driving yourself feels faster than waiting for an ambulance. But stroke can impair your coordination judgment or cause sudden unconsciousness behind the wheel. More importantly, paramedics can begin life-saving treatment while en route. They can contact the stroke team at the hospital, ensuring everything is ready the moment you arrive. Those minutes of preparation can make all the difference. Mistake number 3. Dismissing symptoms as just old age. A drooping smile is not just getting older. Sudden weakness in your arm is not arthritis acting up. Slurred speech is not fatigue from a busy day. These are emergency signals from your brain, and they deserve immediate attention, regardless of your age. Mistake number 4. Ignoring mini-strokes or TIAs. Transient ischemic attacks can resolve in minutes, which often makes people think they are not serious. Nothing could be further from the truth. A TIA is like a smoke alarm going off in your house. It is warning you that something dangerous might be coming. Research shows that people who experience TIAs are at significantly higher risk for major strokes in the following days and weeks. Mistake number 5. Confusing stroke symptoms with heart problems. While both are serious medical emergencies, a stroke is a brain attack, not a heart attack. The treatments are different, the timing is different, and the specialists needed are different. Knowing this distinction helps you communicate clearly with emergency responders and gets you the right help faster. Remember this: when in doubt, act. Your body is trying to tell you something important. Listen to it. These 6 warning signs are your emergency alert system. They do not always happen together. Sometimes it is just one, sometimes several. But even one sign means call 911 immediately. No waiting, no second guessing. Sign number 1. Sudden numbness or weakness. This typically affects one side of your body, your face, arm, or leg. It is not the gradual weakness we sometimes feel with arthritis or fatigue. This comes on suddenly like someone flipped a switch. Watch for an arm that drifts downward when you try to raise both arms, or one side of the face that does not respond when you smile. Betty's son David later told me that seeing his mother's lopsided smile was what convinced him this was not just a tired morning. It was an emergency. Sign number 2. Sudden confusion or trouble speaking. The person may slur their words like they have had too much to drink, use completely wrong words for familiar objects, or suddenly not understand simple conversation. Even if this lasts only a few minutes, it counts as an emergency. Your brain's language centers are crying out for help. Sign number 3. Sudden vision problems. This is not the gradual vision changes we experience with aging. Stroke-related vision problems come on suddenly and can include blurred vision, double vision, or partial loss of sight in one or both eyes. Some people describe it as a curtain coming down over their vision, or like looking through thick fog that appeared from nowhere. Sign number 4. Sudden loss of balance or coordination. A stroke can disrupt your brain's ability to coordinate movement and maintain balance. If someone suddenly stumbles, falls without an obvious cause, or cannot control their body movements, even without pain, do not wait to see if it improves. Sign number 5. Sudden severe headache. This is not your typical headache or even a bad migraine. Stroke-related headaches are often described as the worst headache of my life, frequently accompanied by dizziness, nausea, or vomiting. This can signal a hemorrhagic stroke where bleeding occurs in the brain, which requires immediate, specialized care. Sign number 6. Sudden mental confusion or disorientation. If someone seems mentally checked out, struggles to follow simple instructions, becomes disoriented about where they are or what day it is, or cannot respond appropriately to questions, treat this as an emergency. The FAST method, your life-saving tool. Emergency doctors worldwide use this simple acronym that can save lives. F for face. Ask them to smile. Does one side of their face droop or feel numb? A for arms. Ask them to raise both arms. Does one arm drift downward? Can they keep both arms up? S for speech. Ask them to repeat a simple phrase. Is their speech slurred, garbled, or strange? T for time. If you observe any of these signs, it is time to call 911 immediately. The FAST method helps catch strokes in their early stages when treatment is most effective. Teach it to your family members, your friends, and anyone who cares for you. It is one of the most powerful tools we have in the fight against stroke. Let me finish Betty's story. When the paramedics arrived at Betty's house, they immediately recognized the signs David had described. Within 15 minutes, they had Betty in the ambulance with an IV started and were radioing ahead to the stroke team at the hospital. Within 45 minutes of that first dropped coffee mug, Betty was receiving clot-busting medication that dissolved the blockage in her brain. The treatment window for this medication is narrow, just a few hours, but they made it with time to spare. Today, 3 months later, Betty is not just walking and talking normally. She is back to managing her book club, tending her garden, and yes, making her morning coffee. The only lasting change is that she keeps her mugs on the lower shelf now, and she has taught all her grandchildren the FAST method. But many people are not as fortunate as Betty. Every minute during a stroke destroys nearly 2 million brain cells. That is 2 million cells that control movement, speech, memory, and independence. You deserve better than to lose those precious cells to hesitation or uncertainty. Your independence matters. Your quality of life matters. You matter. So here is my challenge for you today. Learn these 6 warning signs by heart. Practice the FAST method with a family member. Share this knowledge with someone you love today. Do not wait until you need it. The best time to prepare for an emergency is before it happens. Comment "I am stroke aware" if you are ready to take action on this knowledge. And if you found this helpful, please subscribe to Senior Health Facts, because staying informed about your health is one of the best gifts you can give yourself and your family. Many people ask whether strokes can happen while sleeping. Yes, and these wake-up strokes are more common than many people realize. If you or someone you know wakes up with numbness, confusion, slurred speech, or any other stroke symptoms, seek help immediately, even if you are not sure when the symptoms started. The treatment window may still be open. People also wonder about the difference between a stroke and a mini-stroke, or TIA. A TIA, or transient ischemic attack, causes stroke-like symptoms, but they typically resolve within minutes to hours. However, TIAs are serious warning signs that a major stroke may be coming soon. Never ignore TIA symptoms. They require immediate medical evaluation and often preventive treatment. Another common question is whether you are out of danger if stroke symptoms go away on their own. Not necessarily. Sometimes stroke symptoms can appear to resolve while damage continues, or symptoms may come and go. Always treat stroke symptoms as a medical emergency, even if they seem to improve. Only medical professionals can determine if you are truly safe. Many seniors ask about specific stroke risks as they age. The most common stroke risk factors in older adults include high blood pressure, atrial fibrillation, or irregular heartbeat, diabetes, smoking, and hardened arteries. However, strokes can happen to anyone at any age, even people with no known risk factors. That is why knowing the signs is so important for everyone. Women sometimes experience different stroke symptoms than men. Women may sometimes experience additional symptoms like sudden hiccups, chest pain, shortness of breath, or extreme fatigue. However, the core FAST signs face drooping arm weakness and speech problems apply equally to both men and women and should always be your primary warning system. Let me share how different situations require immediate action. When someone experiences one-sided numbness or weakness, this means blood flow to brain movement centers is blocked. Test arm lifting and call 911. If you notice slurred speech or confusion, the brain language centers are affected. Try simple conversation and call 911. With vision problems, brain vision processing areas are impaired. Check both eyes separately and call 911. When balance or coordination is lost, brain balance centers are disrupted. Test walking stability and call 911. A severe sudden headache suggests possible brain bleeding. Do not delay and call 911 immediately. Mental fog or disorientation means brain cognitive centers are compromised. Ask simple questions and call 911. For daily stroke prevention, seniors should follow a consistent routine. In the morning, take prescribed blood pressure medication consistently. Include a gentle 10 to 15-minute walk or stretching routine. Drink water to start the day hydrated. Review FAST signs with household members. During the afternoon, enjoy a heart-healthy lunch with leafy greens, fish, and olive oil. Monitor sodium intake by reading labels carefully. Stay socially connected by calling a friend or family member. Take medication reminders seriously. In the evening, choose relaxing activities like reading gentle music or light conversation. Avoid excessive alcohol with no more than one drink. Prepare for 7 to 8 hours of quality sleep. Keep emergency numbers easily accessible. Here is a bonus tip. Post the FAST checklist on your refrigerator where family members can see it. Emergency preparedness is a family effort. This information is grounded in current peer-reviewed medical research from trusted institutions. The Centers for Disease Control and Prevention provides comprehensive data on stroke incidence and demographics. The American Heart Association and American Stroke Association offer evidence-based protocols for recognizing and responding to acute stroke symptoms. The Mayo Clinic provides detailed clinical information on both ischemic and hemorrhagic strokes. The National Institute of Neurological Disorders and Stroke conducts federal research on stroke prevention and recovery strategies. The Journal of the American Medical Association publishes clinical research demonstrating the critical importance of rapid medical intervention in stroke outcomes. Before we close today, I want to share something important with you. Everything we have discussed today is provided for educational purposes to help you stay informed about your health. This information is designed to help you recognize potential emergencies and respond appropriately. I always encourage you to work closely with your doctor or healthcare team about your personal stroke risk factors and prevention strategies. They know your individual health history, your medications, and your specific circumstances better than anyone. Every person's health situation is unique, and what worked well for Betty and her family might need to be adjusted for your particular needs and medical conditions. Your healthcare providers are your best partners in stroke prevention and overall health management. Do not hesitate to discuss these warning signs with them during your regular visits. Remember, knowing these signs is powerful, but only if you are prepared to act on them. Trust your instincts. If something feels wrong or different, do not hesitate to seek help. Your health matters. Your independence matters. You matter. Stay safe, stay informed, and take care of yourself. We will see you in the next Senior Health Facts video.